So we're going to be speaking about trachoma, and we came up with an idea to evaluate what countries around the world have done to successfully eliminate trachoma. And we want to make recommendations for Australia because in Australia, the local Indigenous community actually is the only community that experiences trachoma. And the Pan American Health Organization described trachoma as, and I quote, a disease of the poor and of the forgotten. Now, trachoma is a leading cause of preventable blindness around the entire world. There's about 40 cases of active trachoma right now, and about 1.3 million people have lost eyesight due to trachoma, and 1.8 million people are vision impaired because of trachoma. And this disease is caused by chlamydia trachomatis, and it causes two main eye diseases. One is trachoma, and the other one is chlamydial conjunctivitis. Now, with trachoma, it moves forward in two main phases. So, phase number one is the trachomatis infection, and that mainly affects children, and it involves repeated bouts of conjunctival infection caused by chlamydia trachomatis. This then moves on to phase two, which is characterized by trichiasis, so the inward turning of the eyelid. And the eyelashes in this phase consistently scratch the cornea repeatedly, and that can lead to vision impairment and blindness. Now, the most interesting thing about this, and I guess one of the very sad things about this, is the World Health Organization says that, and I quote, models suggest that an individual requires more than 150 lifetime infections to develop the blinding complications of trachoma. Now, just to put that into perspective, each bout of trachoma lasts roughly 1 to 2 months. So an individual needs roughly 150 or more infections to be able to get to the blinding stage. Now, why are people around the world going through this when, so much of their life is taken up by infection and an eventual blindness? So that's something that we're obviously very passionate about. Now, the World Health Organization came up with something called the SAFE strategy, and it's a surgery. S stands for surgery. A stands for antibiotics to clear the infection through mass drug administration. F stands for facial cleanliness, and E stands for environmental improvement, such as sanitation and water infrastructure. So to date, about 17 countries have eliminated trachoma, and there are roughly another 40 that still have endemic trachoma, including Australia and many countries that are in Africa. Now, with regards to surgery, surgery is the secondary prevention in the SAFE strategy when the disease gets to phase two, which is trichiasis, and it halts the disease process before it becomes blindness or vision impairment. So, trichiasis surgery is the only treatment that can provide benefit to patients with trichiasis, though the recurrence rates are quite high even after successful surgery, with some estimates saying about 41% of recurrence is actually occurring. When you compare it to other treatments like epilation, which is the removal of the eyelashes, epilation is not as sort of effective. So surgery is the way that people typically go with this. When they actually compared it, there was a Cochrane review which looked at a randomized controlled trial, and they actually compared surgery completed by ophthalmologists and surgeries completed by non-specialist technicians or integrated eye care workers. And they found that at the 3 month and 6 month follow-up, there was no actual statistical difference in outcomes between those patients treated by ophthalmologists and those treated by integrated eye care workers. And so this kind of suggests that there may be some similar effectiveness of surgery despite there being a difference in, I guess, experience and skill level. And that could be really important in areas with, I guess, a lower presence of surgical specialists. In terms of antibiotics, the World Health Organization recommends mass drug administration of both tetracycline, 1% eye ointment, and oral azithromycin. Azithromycin is the first line treatment despite being more expensive and less available. And that's because although tetracycline eye ointment and the azithromycin have actually very similar effectiveness, in the real world, there's a big difference in the way that people actually take the drug because the eye ointment requires twice daily application for 6 weeks, and everyone in the family has to use it. Whereas azithromycin, it only requires a single oral dose for the entire family. So at the end of the day, when you look at compliance rates and the actual, putting it into practice, there's a big difference between the two, and oral azithromycin is much more well tolerated. And I guess one quick thing to mention is that a very useful organization that works on this is the International Trachoma Initiative. And since 1998, they've provided over 1 billion azithromycin treatments and have assisted 17 countries in eliminating trachoma. Unfortunately, Australia hasn't done that. So I think it's really important for Australia to get in onto that initiative and for any other communities that experience trachoma to also get onto that initiative. So I'll pass on to Harnoor, who's going to speak about facial cleanliness and environmental change.
Yeah, so in terms of facial cleanliness and environmental change, those are the more preventative arms of the SAFE strategy developed by the World Health Organization. So facial cleanliness focuses mainly on trying to address all of the environmental risk factors that do end up leading to infection and the reinfection with trachoma. So that's where we're thinking about preventing the 150 infections happening. And the most important environmental factors noticed by researchers in some systematic reviews and was mainly overcrowding in homes, which led to improper storage of bathrooms or cleanliness in bathrooms, improper availability of hand washing and face washing infrastructure. It This kind of environment also leads to an increase in density of flies, which have been identified to be a pretty key vector in transferring infected ocular secretions from an infected individual to non-infected individuals, and then carrying it back and forth and back and forth, so leading to that cycle of infection and reinfection. Improving facial cleanliness with improvement in hygiene infrastructure, like improving hand washing stations, has been found to be quite effective. But a lot of studies found that although this is much more effective than just doing drug administration in terms of long-term prevention, it was pretty limited by behavioral change or beliefs about how resources are expended. So I'll kind of, just in the interest of time, I'll link this in with school-based education programs. School-based education programs have also been found to be extremely effective in helping students who might, starting from preschool ages, who have been found to have up to 60 to 90% rates of active trachoma infection in areas that are endemic. I'm not sure entirely which country this was about. I have to go back into the sources, but it was either Tanzania or Uganda. So it was found that with these students who do have these high rates of infection, students who previously only had a 13% rate of washing their faces and hands, improved to a rate of 86% using this infrastructure that was made available within the schools, in addition to school-based education programs to actually educate students about what trachoma is, how we can prevent it, what will happen if we don't take hand hygiene and facial cleanliness seriously. However, it was actually found to be limited by environments at home, or if students didn't actually have the infrastructure available in schools to implement this knowledge. So schools that did have the infrastructure to consistently be able to wash their hands, wash faces, have soap available, did have a greater improvement in that time period. But schools that didn't have that, the teachers themselves felt teaching this information felt irrelevant to themselves because students couldn't actually implement that theoretical knowledge, or they couldn't go home and use that theoretical knowledge at home because they were limited by that. And teachers were also limited by how they could educate students because in some of the programs that were implemented, they weren't trained in a lot of depth in terms of how to actually use the resources. So there's a lot to address in terms of, yes, we need to improve infrastructure for these communities who have this issue, but we also need to make sure that behavioral change and reprioritization is happening of the resources.
Excellent. Thank you for that wonderful presentation. Questions for our colleagues?
One is asking, can I ask? That's okay.
Of
So
course.
A great presentation, guys. So you talk about this creating awareness and talking to kids and talking to school. But have you taken into consideration the cultural aspects into it? Creating awareness, just educating about washing hands and such. It's just one thing. That's one way. But understanding why they are not doing and why they are hesitant in doing so is it's quite important. So have you taken that into your context or in advising your patients?
Yeah, that's a big component since our research was because this issue is mainly an issue in Australia in Indigenous communities. That was a huge part of what we looked at. And I'll let Fahad talk about the shame element that we did discover. But in terms of addressing community beliefs about hand washing, or some things that we found were not wanting to be perceived like white people. And I say that in quotation marks because these are, white people habits. So there's things like that. And I'll let Fahad talk about shame because that was a big part of his topic.
Yeah, it's a really good question. Thank you for that one. There was interesting thing that we saw is that Australia actually developed a culturally sensitive sort of mascot called Milpa. It's a lizard which is found in Australia, and a lot of Australians know what Milpa sort of is, and sorry, like what the lizard is. And the lizard is made in like a sort of cartoon figure to get kids to be involved. It has indigenous artwork on the lizard itself, and he basically goes around to schools and teaches people how to wash hands in a way that is helpful for children because children are the main carriers of the disease load in the population. So that's one point. The other point is that throughout the when I say integrated eye care workers and other related eye care sort of people. A big part of it is including Aboriginal health workers. So Aboriginal people are the Indigenous people of Australia, and having health workers that understand the needs of the community is completely and almost one of the most important things that will help Australia go towards an elimination. And that's because there is a concept of shame, and shame is basically feeling that Aboriginal people have experienced when they're exposed to the critical gaze of people from the outside community, right? And having people that are actually within the community who are elders or trusted figures are key to basically being able to push this message forward so that it's not looked at as, oh, this is a quote unquote white people thing. It's actually a thing for all people to be doing. And I think that, taking your point, I think it's really important for elders and people who are community leaders to really push these messages forward because that's what we've seen has worked overseas. And hopefully the same can happen in Australia and other countries around the world.
I'll just mention one last thing. I know that they're short of time. So I'm based in New Zealand, and we have here huge Maori community, huge indigenous community, and we include a lot of Maori leaders in educating people. So I think that's something similar that you guys are aiming to do, trying to do. So there's a lot of overlap in their population, and I think in African continent as well. I think that will be hopefully that'll be useful as well.
Thank you very much for having us,
Thank
guys.
you.
Cheers.
Thank you so much for the presentation and the lively question and answer.